Hi, good morning. This video is to my trainer, the Donna the Beautiful. Why she is beautiful? Because she is smiling all the time and she is moving all the time. And I greet her every morning with a special greeting like ballet dancers. I took her permission to mention her name. This is the sunlight and the effect of the sunlight. The sun is a very big star. It is consisting of hydrogen, which is gas. There is no taste, no smell, and no color. And it is in the atomic table, it is number 1. And then it reacts with helium, which is also on the atomic table number 2. It is also a gas. It is tasteless. You cannot touch it. And عديم اللون والطعم الرائحة. My brain is now Arabic. It has no taste, it has no touch, and there is no smell. Now, it is difficult to switch from Arabic to English and vice versa. Anyway, so this reaction is atomic reaction which happen in the nucleus of the sun. Inside the sun, in the nucleus, the temperature is 15 million degrees centigrade, but on the surface of the sun, the temperature is 5,500 degrees centigrade. And this atomic reaction between the helium and the hydrogen, it produces a lot of energy as light and as heat, and it reaches the earth. When we expose ourselves to sunlight early in the morning, when sunrise, there is plenty of red light and near infrared light. Why? Because these wavelengths are long and they could transmit themselves through the atmosphere. But then about 1 hour after sunrise, we will have the blue light and the light, because it is an UV light, because it is shorter wavelengths. So the wavelengths from 0 to 100 is X-rays, and this we use in medicine as X-rays and to diagnose patients, and even sometimes to treat patients with radiation. Now, between 100 to 400 nanometer, this is UV light. UV, ultraviolet light. We divide it into 3 types. A, UVA, which is about 1 hour, within 1 hour of sunrise or 2 hours, and this is too much energy, and it will act on the cells of the retina of the eyes and the skin. There are photoreceptors in the retina of the eye, which is called melanopsin. It reacts to blue light in the sunlight. And there are other receptors for light. For example, neuropsin, it reacts to ultraviolet light. And rhodopsin, it reacts to green light and low activity energy light. So we have many photoreceptors, and these photoreceptors are in our retina, and the retina is part of the brain pushed into the eyeball. And photoreceptors on our skin. And under the skin also, we have photoreceptors in the wall of our blood vessels and in the white fat cells under the skin. So we have to expose our retina in the eye and our skin to sunlight. Now the ultraviolet rays, I said alpha, which will go through the skin and it will affect the mitochondria, and the mitochondria will regulate the production of beta endorphin so that we feel relaxed during exposure to sunlight and we feel warmth because of the red light. And then UVB, which is in the midday, to produce vitamin D. And the wavelength which produce vitamin D is very narrow band of ultraviolet rays, which is 315 to 320 nanometer. And it is between 10 to 3 p.m., 10 a.m. to 3 p.m., according to Professor Michael F. Holick, who is spending about 50 years of his life studying vitamin D and the sunlight. Then we have ultraviolet C, which is in the evening or late afternoon. It does not reach the planet. Why? Because it will be prevented by ozone in the atmosphere. What is the ozone? The ozone is O3, meaning 3 atoms of oxygen. And it is produced in the stratosphere. There are 5 layers of the atmosphere. And this is, I'm talking, stratosphere is number 2 if I am talking from the surface of the earth. And the ozone, how it happened? Because the ultraviolet rays, it will dissolve oxygen into 2 free oxygen atoms, and one free oxygen atoms will be attached to one oxygen atom, and then it will make oxygen, three oxygen atom, what we call the ozone. The ozone, we use it in medicine to sterilize our operating theater, our rooms, and I used to have a device of ozone. I close the doors and the windows of my room, and then I get out and leave it for 2 hours to sterilize the room. It kills the bacteria, the viruses, and the fungi. And then I move the ozone machine into another room. So it is very useful in our medical application. They sterilize the room for the patient. I hope this would be enough for today for my sweet trainer, Donna the Beautiful. Thank you and goodbye.